Hello, everyone, and welcome to our BioHealth Summit panel, COVID-19 Response, where we came from, where we are now, and looking ahead to the next several months. The biohealth industry has been center stage fighting this pandemic, with new therapies, vaccines on the horizon, and medical devices trying to reduce the number of cases and deaths. We have a great panel today that we will be giving you their updates from different perspectives of how we are addressing the pandemic. I will not be reading the bios of our panelists, but you can view those impressive bios on our event platform by clicking on our speaker's picture, their name. This particular panel is a recorded session. However, some of our panelists will be able to respond today through chat if you have additional questions to what I'll be asking. So let's hear from our panelists on where we have come from and what we can be expecting in the coming months. We have on our panel today, Kim Irepu, Chief Medical Officer for Aurora St. Luke's Medical Center, followed by Leonard Friedland, VP and Director of Scientific Affairs and Public Health, GSK Vaccines, Angela Tremmel, Medical Director for Versity, and Blood Bank Medical Director for Froedtert and Medical College of Wisconsin, and Vivek Bhatt, Chief Technology Officer, GE Healthcare Clinical Care Solutions. So Kim, let's start with you. Give us the perspective from a medical center. What have you been going through with this pandemic?
Thank you, Lisa. First of all, thank you for having me on this panel. From a hospital and healthcare facility perspective, there's a series of steps that we typically follow when we're facing an outbreak or a public health emergency. From facilities planning, looking at our ability to surge into areas that we typically don't provide patient care on a routine basis, our procedures, looking to partner with other sites, potentially to transfer patients based on what we're seeing on the ground, conducting infection prevention strategies as well as airflow assessments. So at the start of the pandemic, those were some of the things that we did. Creating an emergency response team that is tasked with looking at each of those areas, including our staffing and labor pool, and a bunch of other things, data management, communication processes, as well as our IT infrastructure. That took quite a bit of time to get up and running, not because we don't typically simulate or practice those things on a routine basis, but because of the amount of information that was coming related to COVID-19, which was very different from some of the things we had faced in the past, as well as some of the uncertainties related to the virus itself. But we were fortunate to have other countries and other places that had experienced it, and so there was a lot to learn from them, and those were the lessons that were very helpful to us at the beginning. We've come a long way since then, and I think, as we'll talk about it a little bit more as we progress, I think we've made significant improvements and advances in how we care for COVID-19 patients, as well as how we manage disasters.
Great, thank you so much. Okay, next we will hear from Leonard Friedland with GSK Vaccines.
Hi, nice to hear from you. Thanks for having me. So what we've been facing with the pandemic at GSK and across all of industry is an unprecedented opportunity to leverage current knowledge of human immunology and advances in biomedical science and apply that to the development of vaccines using both traditional vaccine manufacturing technologies and also some new disruptive vaccine technologies. And we've been able to work faster than in the past because we've been able to do things in parallel rather than sequentially. However, we're also facing a lot of headwinds right now around trust in vaccines and making sure that the public understands that no vaccine is going to be available for patients unless it's judged to be safe and effective. And this is absolutely, absolutely critical because we're going to be giving vaccines to healthy people. We also need to make certain across the entire enterprise that while we are looking to have advances with prevention through vaccination, and we will get there, and we also are looking to have advances with therapeutics for people who are sick so we can stop them from getting sicker, we also need to not dissociate this from the importance of hand washing, the importance of social distancing, the importance of wearing a mask. All of this needs to take place because no vaccine is going to be 100% effective. That is an unrealistic expectation, and no community is likely to have 80, 90, 100% vaccine uptake, especially in the beginning when there is very likely to be vaccine supply and demand mismatch. And so this is what we've been facing, but it's an incredible opportunity to show how knowledge and focus and innovations can advance patient health. So it's an exciting time. We also need to make sure that everything is well understood so people can make the right decisions for themselves.
Great. Thank you so much, Leonard. All right, next will be Angela from Versity.
So Versity is a blood supplier first and foremost. And when the pandemic struck in the middle of March, with everything that was shutting down with the universities and high schools, that's where a lot of our blood supply comes from. So there was a lot of uncertainty and concern that we were going to go into a very severe blood shortage. And then kind of shortly after that, hospitals started slowing down with surgeries and other, admissions. And so actually we saw our demand went down as well. So we kind of stabilized a little bit with the blood supply, but then the idea of convalescent plasma came about. It had been used in prior pandemics, and that really brought the blood suppliers, had to quick hit the ground running, because this was kind of uncharted territory for us, because convalescent plasma is considered an investigational drug. And we typically just deal in blood supply. So, initially here in Wisconsin, we weren't New York or Washington, and we didn't have these cases that had been going on for, at least several months or weeks. And when the demand started for convalescent plasma, we actually didn't have a big donor pool because we didn't have that many people who had been sick, and you have to wait so long. So initially, pretty much every donor we got in to donate convalescent plasma, that product just went right out the door. But then as word got out about this, potential therapy, the community really responded, and we have donations, and now we actually have a built-in supply for all the different blood types across our 5 states that we supply to, as well as, we're planning for a surge too. So I think we're in a much better place currently. We, did many things quickly to get the convalescent plasma program off the ground, and now we're looking at how we can be more efficient and also roll with the punches with new guidance documents coming out from the FDA. So it's been a real learning curve for us, but I think we've succeeded in meeting our community's demands and our patient needs.
Great, thank you so much. And then let's go to Vivek, and then we'll go to questions after Vivek.
Hi, thank you for having me. I'm part of GE Healthcare, and for us, it was actually a very interesting combination. We are a business, of course, but at the same time, you're in the healthcare space. And we do everything from, big imaging modalities to the business that I'm part of, which is the clinical care solution, which has things like ventilators, ultrasound machines, patient monitors, and so on. So we actually had almost a front row seat in terms of what the state was, what the hospitals were asking for, what customers were asking for, what the governments were asking for, and more importantly, how we as a business were going to run to be able to keep up with it, especially because we didn't have the opportunity to just shut down or take it slow, because our customers and patients needed us. So our first priority was really around employee health and safety. And that was not just a good thing to do. It's think about the field engineers that are out there. that are keeping the equipment in the hospitals up and running. We talk about, back in the days where like, ventilators, I mean, that was the biggest thing that people were really worried about. The production employees that needed to come in and made sure that the production that was needed, because the demand was going through the roof, right? So that was extremely important. So the employee health and safety, from that perspective, as a contribution to make sure that we can support our patient, we can support our customers. So that was number one. The second piece for us was really the manufacturing capacity. And to just give you a sense, there are, for product lines like ventilators, it almost went up 10 to 20 times the demand, right? And we had to kind of go figure out how to go meet that kind of an increase in demand while the supply chain is shut down, because like China was really hadn't come back yet at that time. The supply chains are global. So how do you actually go figure it all out? And so we really put a tiger team together to figure out, look, how do you get these parts? The airlines were shut down, so you could not even expedite parts through. So working with private operators of airplanes and stuff, because passenger traffic was gone and cargo traffic was gone. Right? So how do you kind of go figure that out? And then our internal capacity, while people were really afraid of kind of like coming into work, even if you have the parts, how do you kind of go make these, get enough people to come in? And we reached out to the community, we reached out to some of our partners, and try to increase capacity from a people perspective. And then there was a lot of questions around how to use our devices in a way. It was a different world, right? So normally when, for example, you take a CT and, that's novel operation. Now you wanted to have a patient that is probably extremely contagious. You don't want your technician to be in touch with it. So how do you do innovation very quickly? And, we came up with, say, that's just an example, with a CT in a box, where you had something where you actually put the whole piece, electrical, AC, the separation of the patient and the technician, and made it a turnkey so that you can just go drop it, maybe even outside the hospital, and have a CT up and running in that short time frame. We ended up partnering. The president asked Ford and GM and some of our auto manufacturers to go on a war footing to produce ventilators. So we had a great partnership that we worked with Ford, and we produced 50,000 ventilators. Here in Wisconsin, we increased our capacity for ventilators almost 4 times. So all these different pieces, both that there was a combination of the healthcare, keeping that going, keeping our customers up and running, and also how to run as a business. So that was a very interesting thing as it evolved.
Excellent. Thank you so much. So after listening to all of you, and I think you're going to come at this differently, and you were all kind of hitting it. So you all responded, right? You immediately responded to this pandemic, but now, and maybe it's still too early, because Angela, you even brought it up, and we all have been hearing it, the surge could be happening, right? So the flu could be hitting. What will it be? Is it the flu somebody has versus COVID? But, what have you taken from this, whether you want to talk about processes, your workflows, you mentioned safety, what is it that you're taking from this? Or again, do you think in 2021 you're going to look back and go, here's all the things we've learned from this, and here's what we're going to implement from this? Can you just talk maybe from different perspectives, what this has done to your companies, whether you want to hit it from a product side, certainly from a hospital side, it's going to be very interesting, Kim. And then you were mentioning, Vivek, is there things that GE is going to come in 2021 and go, we learned a lot from this, whether it's on our supply chain or whatever it may be. So if all of you could just, Vivek, do you want to just start? And then when we go back with Kim, Angela, and Leonard, and how you guys see this, what have you learned from this?
Right, so you already touched on one, right? The supply chain. Because at the end of the day, if you cannot produce, innovation, all that stuff doesn't matter if you cannot produce it. So really kind of taking a hard look at the supply chain. And, it's not about just the geographical distribution of the supply chain. It's about having alternates. And when you talk about having alternates, more than one supplier, because you can never have a single point of failure, whether that failure be a single supplier or suppliers concentrated in a certain geography. So that's something that we have to fundamentally step back and say, how do you make it robust? And there's just one other piece which is very different. I talk about the power of partnerships, right? And I already talked about the fourth thing, but the other piece that we realized is the transformation that I've seen. There is this thing which says the digital transformation of healthcare was on people's agenda, was on people's vision for the next 10 years. That 10 years got compressed into 3 months, right? I mean, like we right now we are all on Zoom, right? I mean, if you think about it, I mean, you would never have a panel like this in the past. We'd all be sitting there. So this whole digital transformation for healthcare, and the fact that a transformation like this takes a large number of people to come together in a partnership to make it happen. So that's the other takeaway is, look, there is that transformation coming, and that transformation is going to be enabled by some great partnerships that we have to form between the payers, the providers, the tech industry, the healthcare device industry, and we all have to come together to kind of make that happen. So those are the two key ones that I can think of.
That's great. Kim, also address, and I know you have some other thoughts of what you were going to say, but it's just that I've recently read that N95 masks you can't get the supply. So as you're talking about, as you look at the future, I'm also really curious on your response of just PPE supply. Here I thought we were all in great shape, but now I'm reading. So anything how you want to address this question, but now I'm throwing in one more. What are we really facing from a healthcare system as you go forward, especially if this surge happens for you?
Absolutely. And before I get to the question around PPE and N95, I think Vivek touched on quite a few things that are worth reiterating. Mm-hmm. When he talked about diversification or the need for that with regard to our supply chains, one of the concerns that actually came about earlier for our organization was the reliance on a single supplier or manufacturer, which created a problem down the line when those supplies were then diverted to a different part of the country. And so I think it's taught all of us a very important lesson about the need for diversification. But even beyond that, inventory management systems have changed, not just in our industry, but in a lot. I think most business folks will tell you about the benefits of just-in-time manufacturing and relying on that sort of a process with regard to your supply chain and inventory management. The issue with that, of course, is when you're facing shortages on the supplier perspective, that creates a major concern. So I think we've all had to adapt our inventory management system so that we incorporate other elements as well and not rely strictly on one method of doing it. You also talked about workflows, which we've all had to adapt. Where patients are cared for is a little different from where they were previously cared for. And the processes that we use to provide that care has also adapted based on lessons learned as a result of the pandemic. And Vivek touched on the need for, even in imaging, to have a process around cleaning and making sure that those who are involved in the actual patient care or at the forefront of those imaging processes are not exposed to risks related to an infectious process. So we've all had to adapt, but specific to PPE and N95s, I think we're all in a good place now. And some of that is because there's been a push by some of our local manufacturers to actually begin to produce N95s in much larger quantities. I know one of the companies changed their manufacturing systems to now focus on N95s. And I think we're all in a much, much better place. Now, it's difficult to say what's coming in the future, and especially if we face a second wave. I think we're all working with the assumption that there is one coming, and we're following a conservation strategy that ensures that we'll have things in place if that were to happen. And it's not just specific to N95s. We have isolation gowns, face shields, and a whole host of things which are in abundant supply now, but potentially could become strained if things were to take a turn for the worse. The other thing that Vivek touched on was the need for collaboration and partnerships. And I think some of that has driven innovations even at the hospital level. So we've partnered with our clinical engineers in the hospital around reconfiguring some of our anesthesia machines, as an example, which traditionally are not used as ventilators outside of the OR, but can be configured to meet the needs, which adds to our inventory in the event that we face a significant surge. So there's been a lot of learnings. You know, a lot of our employees work from home now. So we're looking at things like that and really relying on technology to help the communication process and teamwork that traditionally needs to happen in the hospital environment. We're doing the same with virtual visits. So technology has really played a big role for us. And I think a lot of those were driven by some of the things that we had to face at the height of the pandemic.
Great, excellent. Angela, how about you? Any part that you want to come from a company perspective, product perspective, or any of these comments? Yeah, how do you see it?
I think the collaboration, what I saw from both the Versity side as well as my hat as a physician at Fredericton MCW is, you know, at the hospital, all the hospitals in Southeast Wisconsin really came together and helped with the blood inventory. We all, you know, if there's a bleeding patient at another hospital somewhere, you know, we adjusted our inventory to help one another out in a time when, you know, we weren't sure what was going on. And I think too, we shifted a lot at the blood center. As I mentioned, a lot of our blood drives are mobiles. So going into the community, going to a hospital, going to a business, going to a university, and it was about 60%, and 40% of our collections actually came from fixed sites. That is completely flipped, but that took, you know, very quick planning, and I don't think that's going to change for a very long time. And so you know, we had to adjust, and I think we've learned from that maybe now we can bring more people to our fixed sites now that we aren't able to go into the community as much and go to businesses. But it definitely, I think we've learned a lot. Some of the stuff I do think at both Versity and at my blood bank, some of the changes we made, they were good changes. We learned a lot, and I've actually implemented things permanently because I think it just pushed us to do things quicker than maybe hemming and hawing. So there were some positives that did come out of all of this.
How we have to look at this, right? I mean, I've been saying that. I mean, you do learn from some of these things when a crisis occurs. You have to find those positives. So Leonard, how about from the GSK perspective?
Yeah, thank you. So in addition to what Kim and Angela and Vivek have spoken about, I'm going to focus in, I think, on three areas that we've been learning. The first is what people have been speaking about, collaborations, the importance of collaborations and how we can collaborate with people we would have never thought to collaborate with before. So for example, at GSK, we have a technology platform referred to as adjuvants. These are substances that can be formulated in vaccines to enhance and shape the immune response to the antigen. This is a very mature technology that GSK has been leading in. It's an R&D company for more than 2 decades. And in the setting of COVID, we would use our adjuvant, which hopefully could result in what's called antigen sparing, so less antigen per dose, giving more doses to the 7 billion people on this planet who could benefit from a COVID vaccine ultimately. We need a protein, and there was another company that had a more advanced protein in the clinic that we could work with so we could get there faster, and that's a company called Sanofi Pasteur, which is the other leading manufacturer for vaccines. And so our group we usually compete with, now we have a collaboration with, and we're working together to bring a protein adjuvanted vaccine to clinic, and it's right now in clinical trial. So incredible opportunity, and I could say that we were so proud that we were able to work with our competitor as a partner to advance patient health. So collaborations, and we're seeing this all across the industry as everybody's been speaking about. Second thing to focus in on is people. We've been able to see how incredible our employees are, how people are literally working every day, more than they've ever worked before, because we all have the patient in mind, and that's the goal. And so our people have completely risen to the occasion, which is no surprise, but it's just wonderful to see how everybody And we see this across all sectors, across the biomedical industry and across society. So that's a positive that's come out of this, is how we just all need to work together, right? It takes a village to make this all happen. And we see it in our people, and it's wonderful. And people are given opportunities they may have never been given before. And it's just fantastic. And it's heartwarming to see this. And the other thing that we've learned, and I think this is very important to mention, is that we've seen a lot of advances in healthcare have a few steps backwards. So here, I'm speaking now as a vaccine research scientist. We've had tremendous strides in getting more and more of our population immunized against vaccine preventable diseases, in particular, adult vaccine preventable diseases, against pertussis, against pneumonia, against shingles, and against influenza. In particular, those 4 vaccines are all recommended for adults. Office visits and visits to the retail pharmacy have declined dramatically during the pandemic. Office visits at one point were down 60 to 70% from pre-pandemic numbers. In the Veterans Affairs Administration hospital system, there have been 88% declines in pneumonia vaccination. Shingles vaccination from the peak of the pandemic was down close to 70%. We need to get these vaccination rates higher, especially now as we come into the fall and we're going to face influenza. We need to make sure that our populations are vaccinated against influenza, against pneumonia, against pertussis, against shingles. We want to not have people go to the office to see their doctor because they have a case of shingles and they could be around somebody else who's sick, or have to go to the ER because they have influenza and maybe take up a bed for somebody who might have COVID. We don't want those ventilators to be with influenza patients if they're then not going to be available for a COVID patient. And so we have to get back to where we were. And that's really critical. We were making great strides in healthcare around immunization, and we've seen declines. We need to make that happen. Around the world, we're at risk for having outbreaks of measles, of pertussis, because vaccination rates have declined in the EPI and the WHO programs around the world, as societies are struggling with their resources and people are scared to go visit. Pharmacists and doctors, we know, have created safe ways that people can go to the hospital and get their routine care. They can go to the pharmacy safely. They can go to the doctor's office safely. So that's another thing that we've learned. We can't take our eye off the ball for the other things that need to happen outside of the pandemic, and they're all related. So that's a really critical thing. We need to make sure we stay healthy. And one of the ways we're going to do that is through vaccination and also making sure we care for ourselves.
So I'm going to kind of go now specific to you guys in your particular areas, but I'm going to keep Leonard on because I want to have him keep talking about vaccines for a minute, because again, a big spotlight, right, on the vaccine area, certainly with COVID. But my question to Leonard is that you talked about the importance of vaccines just now. You're making your case, but many people are fearful. So aside from just what you said, there's this emotional response, and a lot of times from parents are going, am I sure about, and this is, let's not even before COVID was hitting, right? It seems like I'm rushing through these vaccines, or now with COVID, people are questioning the safety. So there's an emotional response, right? Rather than maybe logical, but an emotional response. How do we communicate and make sure that people are feeling comfortable in the safety? I know you said it in your opening presentation, there is no way this industry is going to come out with a vaccine for COVID if it's not safe. You said that, but are there other ways with messaging to make sure we are addressing just fears that even just go to standard immunizations that parents have had, and making sure that they are comfortable? And is there different messaging maybe that we can have to make sure people are truly comfortable on the safety issues with vaccines? So I don't know if how you address it, because it's a little different way to come in, right? It's a more of an emotional response than a very factual, scientific response, right?
Absolutely. No, thank you, Lisa. So do we have 3 hours?
I know.
There's a lot to cover here.
I know.
But with joking aside, I mean, vaccination needs to be a cultural norm. And we weren't there even before the pandemic started. And now we have the pandemic, and vaccination and public health has become politicized as well. And so it's a perfect storm that can be very frightful and scary for families and for individual patients, etc. We all want our children to grow and have every chance in life to be healthy. We all want our families and ourselves to have every chance in life to contribute and be healthy and be protected. And so what we need to do to try to make sure that there's a vaccination at every opportunity is we need to listen. We need to listen to what people are saying. Ask people open-ended questions. What are your concerns? Let me listen to you. Affirm what they're saying. I'm hearing you. And then reflect on what they're saying. And then summarize what you've been hearing. And that sort of motivational dialogue of open-ended questions, of affirmation, of reflection and summary, then together a family can make a decision. But we need to listen and take the time to do this. And if we can strip away the politics and focus in on what's important, it's people and their health. Now, I'm a pediatrician. I still practice in the state of Pennsylvania. I've seen what these diseases are. I had 2 children in my hospital in the winter of 1990 in Philadelphia who died of measles. Measles. People in the United States dying of measles, vaccine preventable disease. Our population doesn't know what these diseases are and how important vaccines are to prevent polio and Haemophilus influenza type B. 100 children died every year in the United States due to chickenpox before there was a chickenpox vaccine. People died from rotavirus, etc. So these vaccines are so critical, but people don't really know what we're preventing. We need to have an open dialogue, listen carefully, and reflect on what they're saying, and then have a communication approach that allows people to make an informed decision for their family. And we also need this from our government. Our government needs to have a communication strategy on how we're going to communicate the safety and the efficacy of whatever interventions are coming, be they therapeutics or vaccines or non-pharmacological interventions as well. They're all critically important. So that's sort of a 3-minute response. We have to listen, and we need to be part of this dialogue and reflect and summarize on what we're hearing.
Great.
Yeah, Lisa, it's almost...
Go, please.
Yeah, I just wanted to, what Leonard just said, it kind of brought home to me, like a key point. See, normally you think about there is a fear. So let's use data to deal with that fear. And, of course, once you get the data and logic out there, I think it's that fear, it's not really fear. It's about the trust, right? Mm-hmm. It's about, healthcare is about trust. And it's about, look, do I trust my life? That's what we're talking about. We're not talking about, my bank account or whether I should invest in a stock. It's my life. It's my loved one's life, right? And so I got to be able to trust the information. I got to be able to trust the person that's giving it to me. So I think what Leonard, it kind of just brought that home, that it's about the dialogue. It's about understanding. I mean, it's about what you would normally do in a relationship and, with your friends. How do you build trust? I think that's really a key part. I mean, and thank you, Leonard, for sharing that. I think it's something that, at least as an engineer, I kind of take back from this conversation. That it's not just logic and facts. It's the trust. That's kind of where it all starts.
And if I may just
please, yes, go ahead. I was going to call on you, Kim. I want to hear it from your perspective.
I think both Leonard and Vivek, hit the nail really spot on. I think as scientists, we focus a lot on data, and we think that the data should make a convincing argument, and therefore everybody should be on board. But as a practicing clinician, we tend to see things from a different perspective. There is the data, but there's also the person. And I think each person comes to the table. I think I once heard a saying that physics has no point of neutrality, i.e. we all see things based on our previous experiences, our beliefs, our values, and a whole set of other things that play a role. So when a lot of people come into the healthcare system and already have some of those innate concerns, issues with trust, I think it's important that we listen and understand where they're coming from, because that's the only way we're going to be able to drive the conversation in a positive way and hope to attain some of those outcomes that we're all looking for. And that is so important. We don't do enough of that. And unfortunately, like Leonard mentioned, issues of public health have become politicized. And public health is one of those areas where when you prevent something, you have no way of knowing what would have happened if you didn't put the intervention in place, which places public health in a very challenging position. And so it's only by helping people understand what we're trying to accomplish, by hearing where they're coming from and being able to have those conversations, that we're going to be able to change their perceptions about healthcare in general, and specifically around vaccines and their efficacy and importance.
Excellent. Angela, I don't know if you want to add anything to this discussion or?
I saw it in the hospitals too. Just initially, patients didn't want to come in. I oversee some outpatient procedures, and, they were teetering like, should I go to the ER to be admitted? And, is this safe? And I just, I would listen and I'd be like, I think that the hospitals have really stepped up and we are safe. I actually think you're probably safer in the hospitals than staying at home and, dealing with whatever the crisis was that this, certain patients are having. But I definitely did see that, people were fearing coming into the hospital initially when all this started. And I know the first day I walked in after, working from home for a week or two, my husband too was like, you're going in there? Like, yeah. And I actually called him. I said, I feel safer here than I do going into the grocery store. Everyone is masked. There's not many people in here. We've limited visitors. We're all social distancing. And I made sure to tell him when I saw my outpatients this kind of stuff, as well as friends and family, to be like, it is safe. You need to continue to get your health care that you need. You need to go get your kids vaccinated once your pediatrician's office opens. Don't be fearful of these things. And I think, we can use our platform of being clinicians and being in healthcare to let just even friends and family know that this is okay, because then they will spread that, and as well as our patients.
Great, thank you. I'm going to stay with you, Angela. So let's just go to let's flip back to COVID now, response and the therapy. So to receive the convalescent plasma, it was big in the news again for many months, and now it's kind of big again, saying, well, does it really work as a therapy? So what is the answer? And then when you were presenting my question, and again, it's probably that I don't understand, when I've had COVID and now you're taking my plasma, does it matter how strong my response was to COVID as far as my antibodies? Because if I just didn't have a very much of a response to it, I'm not going to have as many antibodies, right, through my plasma. So I'm asking a couple of different questions here. And it's probably because I don't understand the medical side enough. But if you could just address, is this a therapy that can really be used right now? And then also, how effective is it, depending on what kind of response I had to the COVID?
Sure. So it is a therapy. It's one of the few therapy options we have currently. Is it going to, 100% effective and work for every patient? No. But it is one of the few options we have. It seen from the Mayo data, as well as some other smaller publications, it appears that the benefit is early. So if we give this to patients early on, before they've been put on a ventilator, it seems that we may be able to stop them from progressing to going to the ICU and being put on a ventilator. So what I've seen is that we are giving this product earlier, or this investigational drug earlier, and not waiting for giving it to our sickest patients. There are definitely patients who get this and they turn the corner, and then there's others that don't, and that probably relates to antibody levels in that plasma, as well as other, everybody is coming from very different backgrounds. An oncology patient is going to have a different immune response than a previously healthy adult patient with no other comorbidities. But we don't have great tests right now to actually know what the antibody levels are these neutralizing antibodies. We are hoping that there are sufficient levels of antibodies in this plasma. So, you know, there have been a couple studies that have shown or suggest that the sicker you are, the more antibodies you will produce. And that those are the patients that we should target to try and get them to donate. But we don't have great evidence right now of who the ideal plasma donor is. So currently, we have to have documentation that you actually did have COVID, whether that's through a diagnostic test or antibody tests. And then you have to be 14 days symptom-free to come in and donate. And that's protecting the people who are collecting the product. We don't want someone who is still sick and contagious coming into our donor center and then getting, you know, our staff and our blood collectors sick. So it is an option. We here in Wisconsin, we've issued about 1,500 units since the beginning of April to our hospitals, mainly in Southeast Wisconsin. Across Versity, we've issued, which covers Michigan, Indiana, Illinois, and Ohio, just under 7,000 units in that time. So I think it's an option. Is it perfect? No, and I think we've got a lot more. We need to do some randomized controlled trials to figure out what to do with it.
Great, thank you. Vivek, how about you as far as just with the imaging side? Because I want to stay a little bit on the therapeutic and then get to Kim, how he's utilizing this. Is there things like long-term, like with fibrosis of the lungs, are there things at GE just so that hospitals have, in a sense, the imaging treatment, right, to know what they should be doing? I mean, how's GE coming in on this?
So Lisa, so one thing, you know, whether it's ventilators or whether it's the diagnostic imaging side, you know, the way I think about it is we provide the tools for diagnosis, right? So in the case of imaging that he asked, so look, COVID is a respiratory illness, right? Now there are other respiratory illnesses that exist today that have existed for a while, and there are standards, you know, whether it's ultrasound, whether it's CT, whether it's basic X-ray, right? So those are all ways to diagnose. Now, whether you want to diagnose the progression of disease, and you know, you're not talking about diagnosing the disease itself, right? Because there are much better ways to do that, right? Now, whether you want to say, look, I mean, how is the disease progressing? Especially because what you don't want to do, you know, sometimes you're looking at the anatomy can actually tell you that it is going a lot faster and there might be a crash coming. Because the human body is actually very good at adjusting, and you don't see that things are going south as quickly as, you know, like being able to see the change in anatomy, you know, can actually tell you. So there is that aspect, which is for certain, you know, for a certain set of patients, how do you look at how fast is the disease progressing? Is that something that I need to be worried about this patient, you know, potentially crashing or really kind of, you know, going down very quickly, and you know, is there an intervention I can do? So that's one side. The other side is, and look, you know, there's a lot of literature, a lot of people doing research around that, and we are keeping in touch with, you know, with those researchers to say, look, I mean, what other additional tools do you need in addition to the device and analytics and AI-based algorithm that can help you do that? And the second thing is about after the progression of after the patient gets better, what are the long-term impacts, right? And, you know, what kind of therapies do you want to do to kind of get them back to where, you know, as close to normal as you could, and whether those therapies are being effective or not. So, I mean, we think about the diagnostic imaging more as a way to see either the progression or the effectiveness of the treatment, you know, post the disease itself.
Great. So we just have a couple more minutes and then we'll conclude. Kim, I just want to hear from you. Is it hospitals, as we're going forward, is the stat we should be looking at is hospitalizations that really is dictating how do we need safe at home again? Or is it the number of cases? All I see now are number of cases, but, or is it do we need the hospitals telling us, we need, this is bad right now? I'm confused on what we should be looking at, because only the news is just these graphs all the time. And honestly, I think people are starting to go whatever. And I think, as Leonard was talking about, so what about the mask, or so what about hand wash? You just don't even pay any attention anymore. So how do we make the communications better? And should it be coming from the hospital systems?
Lisa, that is such a great question. So when you look at test positive rates in the community and compare them to hospitalizations, deaths, and every other metric that we tend to use, they each have a role. So it's not a question of either or. From a population health perspective, or from a public health perspective, those test positive rates really help us understand the spread within the community, as well as whether the measures that we put in place, whether it's safer at home, universal masking, and all the other things are actually having an impact, and help direct and guide decisions around when to reopen facilities and what additional steps may be needed. So they're very helpful even to the hospitals, because it sort of warns us about what might be coming. When you begin to see the rates of positive tests increase in the community, we know we have about 1 to 2 weeks or so before we begin to see an increase in hospitalizations. Now that depends on so many other factors, such as the types of people who are getting infected. We see a disproportionate number of the elderly, and especially those who have multiple comorbidities, get sicker. Now that's changing. And as we look at that data, that test positive rate, and looking at the fact that we're now seeing a lot more younger people get sicker and require hospitalizations, it also warns us about what we might have to do. So they look at things from a different perspective. And as hospitals see that data, we begin to look at our supplies, especially when you look at ventilators, ICU beds, and a whole host of things that we may need to have in place. From hospitalization, it really talks about how severe the illness is, because typically people wouldn't come into the hospital unless they're very sick. And so it also gives us a different measure that we take a look at in terms of our planning efforts. But it's not an either or. And most of the data that you're actually looking at is based on collaboration. I know we've touched on that quite a bit between the hospitals and the public health facilities, because we work very closely together around our preparations for COVID-19. So I think it's important that we pay attention, not just to the hospitalizations, because that may be what you're hearing, but also to the test positive rates, because I think it warns the community about what's happening and what additional measures may be needed to help curtail that. Otherwise, we may be dealing with the sequelae, which is an increase in hospitalizations and deaths. I hope that helps.
That was helpful. That was helpful. Thank you. Because I think I am not unlike a lot of people, that you become immune to all that, right? And I do think that affects all of us, that it gives you reason, maybe I don't need to wear my mask. I mean, you just start ignoring some of that. So that was extremely helpful. So I think we need to be ending this session. I think we've almost hit our hour. I really want to thank these panelists. Thank you so much. This was very insightful. And I really enjoyed hearing from the different perspectives. I just want to emphasize again, I am so impressed with this community from this, and we call the biohealth community, because it really spans from vaccines, therapeutics, diagnostics, medical device, the hospital systems. It really is this whole area we call biohealth. And with the collaborations is what is so it's inspiring. As you said, Leonard, you don't see competitors coming together as much like that. I mean, this industry really stood up and said, it's about patient care, and we're going to do something about it. So I thank all of you, and attendees, get your flu vaccine, please. Get your flu vaccine. Help Kim, help everyone. It is critically important. Spread the message. It makes a difference. Wear your mask, socially distance, wash your hands. I mean, we can do something about this, but it takes all of us to do it. So again, thank you to the panelists. I truly appreciate it. And have a great day, and everyone stay safe. Thank you.
Thank you, Lisa.
Thank you.
Thank you.
Oh, you caught me. Hi, it's me, local celebrity Carissa Barreca. You might remember me from such unforgettable performances like the Wisconsin Biohealth Summit, opening act I did with Lisa Johnson just 6 hours ago, or an internet mattress commercial, or a 7-episode arc on Fox TV's Empire. That one's actually real. I'm pretty proud of that one. And like most local celebrities, I'm here to talk to you about something that's really important to me. It's the Wisconsin Biohealth Summit, Day 2. Day 2 is filled with extraordinary speakers, sessions, and events like
a fireside chat with Elliot Francis, networking sessions focused on D&I and engaging diverse audiences, a keynote from Darcy Luoma, networking sessions for women in biohealth, training sessions with Jill Mueller, and the funniest networking event ever hosted by the Second City.
In fact, if you come to Day 2 of the Wisconsin Biohealth Summit, you'll also be gaining
insights into new ideas, collaborations, and innovations. First looks at cutting-edge trends and technology. A chance to celebrate you and your industry's successes. Memories to last a lifetime. 4 to 6 new best friends. My personal bank account information. A lot of laughs. And a pony. Maybe, probably not, but maybe. You don't know.
So September 30th, remember this advice from local celebrity Carissa Vareka. Come to Day 2 of the Wisconsin Biohealth Summit. Live, laugh, love, learn, maybe get a pony. I don't know. Probably not, though. Okay, I don't want to get sued for that. Like, you're probably not going to get a pony. See you next week.